pleasant day to everyone. Welcome to the concurrent oral abstract session of the International Council of Nurses 2021 Congress, the virtual meeting place of the world's nurses, with the theme Nursing Around the World. I am Professor Dr. Michael Joseph Dino, the Research Development and Innovation Center Director of the Our Lady of Fatima University Philippines and President, Phi Gamma Chapter, the only virtual chapter of the Sigma Theta Tau International Honor Society in Nursing. And I am pleased to moderate this special session on digital health and innovation. Digital health can benefit patients, healthcare professionals, health organizations, and public authorities. Digital health, when applied effectively, deliver more personalized, citizen-centric healthcare, which is more targeted, effective, and efficient, and help reduce errors, as well as the length of hospitalization. Nursing now and in the future relies on the availability of meaningful data and new technologies, such as artificial intelligence, to support personalized nursing care and improve health. This sub-theme explores the digital transformation, outlining digital technologies in the use in all of the domains of nursing. At this juncture, we are excited to welcome our distinguished research abstract presenters from the different parts of the globe. To begin with, may I introduce our first speaker. Our first speaker is Jiaying Tang, a nurse from Hangzhou, China. After graduation in 2014, she has worked as a clinical nurse in EICU or Trauma ICU at Second Affiliated Hospital Zhejiang University College of Medicine, one of the top 100 hospitals in China. Our presenter has specialized in comprehensive care and treatment of critically ill patients. Having a strong interest in nursing research, she joined Nursing Research Group of ZUCC and studied the documents to improve nursing equipment and solve some technical problems. Through analysis of characteristics of diseases in IECU patients, her team proposed to combine 5G network, artificial intelligence technology, and thermometer to construct a new intelligent continuous body temperature detection system. This equipment was adopted by the Nursing Research Group and her team applied for a patent in China. The practice to improve the medical apparatus gave her insights to problem solving with creative ways. Let us all welcome Jiaying Tang for his presentation entitled Application of Intelligent Continuous Body Temperature Detection System based on 5G technology in body temperature monitoring of ICU.
Thank you. So, hello everyone. My name is Tang Jiaying. I'm an ICU nurse from China. I feel very honored to participate in the International Nurse Conference in the crowd and share the research result of our team. Today, my topic is application of intelligent continuous body temperature detection system based on 5G technology in body temperature monitoring of ICU. First of all, I would like to talk briefly about my work and hospital. After graduation in 2014, I have been working in the trauma ICU as a clinical nurse. I work at the Second Affiliated Hospital of Zhejiang University, one of the top 100 hospitals in China. The hospital has 3 campuses with a total of 3,800 beds. The trauma center where I worked is one of the national regional trauma centers in China. Last year, our team worked with AI companies and Zhejiang University to build the first AI ICU in China based on the hospital 5G high-speed network. Today, I'm going to share with you one of the results of the cooperation, Intelligent Dynamic Temperature Warning System. I will introduce the the slide don't work. I can't. Uh, I will introduce the following 5 parts: introduction, research objectives, materials and methods, result and conclusion. Firstly, I will give a brief introduction of the background. As we all know, body temperature is an important part of vital sign monitoring in ICU. It's reported that body temperature more than 39.5 degrees is significantly associated with increased risk of death. Real-time detection of body temperature can advance the time of empirical treatment and help improve the treatment outcome of patients in ICU. At present, thermometers have become a widely used detection method in ICU in China. Although various devices are used for continuous body temperature monitoring, most of them cannot widely carried out in clinical practice. So exploring new real-time continuous monitoring method of body temperature has become a common problem for ICU medical staff. Nowadays, China formulated sorry, Nowadays, China formulated the standard for hospital network construction based on 5G technology in 2019, and this measure will further boost the construction process of intelligent hospital. Continuous body temperature monitoring system is developed based on 5G technology, which can realize rapid facial recognition, intelligently log the temperature measurement site, and accurately calculate the temperature. At present, it has been applied in non-contact contemporary equipment. So the aim of our study was to explore the feasibility of non-contact continuous and real-time intelligent body temperature detection system in ICU and to provide reference for the selection of body temperature monitoring method for clinically ill patients. Our, our study was a prospective study in which 30 patients admitted to the trauma ICU from January to December 2019 was selected by convenience sampling. In this study, only adults was included, and the blood temperature was measured using a Pico catheter. The thermometer was used to measure temperature. We used the Pico catheter produced to measure the blood temperature, and the intelligent continuous body temperature monitoring system, we named it ICT-BMS, which was used to measure the forehead temperature. The structure of ICT-BMS includes body temperature collector, calibration black body, wireless router, and display devices. According to the three measuring devices, our team developed strict procedures and operation steps, especially SAT-BMS. When we use it, it should be installed by the manufacturers, and we need to keep the patient's skin dry when we use it. The system automatically analyzes and records the patient's body temperature. According to the nurse routine of body temperature monitoring in ICU, temperature measurement was performed every 4 hours, and the measurement results of the three methods were recorded, respectively, for 48 hours. According to the temperature measurement method and the time of this study, 12 data were combined for each temperature measurement method within 48 hours for each patient, with a total of 36 data. The gold standard for this diagnostic test uses blood temperature, which define higher than 37.5 degree was have a fever. For the part of statistical analysis, Pearson coefficient (ROC curve) was used to calculate the correlation between different methods. The next step is the result of this study. Table 1. Uh, Next step, I will show you the result of the study. Table 1 shows the characteristics of patients forming our study group. The result of paired t-test showed that there was no significant difference among the three methods. Next, correlation analysis showed that there was a good correlation between semester, ICT-BMS, and gold standard. And the ACT-BMS showed good relation with picocatheter temperature measurement, and the sensitivity and specificity, PPV, MPV, and the diagnostic efficiency were 73%, 100%, 100%, 94.8%, and 95.7%, respectively. Sorry, I can't. And the area on the ROC curve was 0.887. Additionally, ICT-BMS requires only need the shortest time for each patient. And the last one, the conclusion, the result of our study. Sorry, I can't. Could you help me to show the next slide? Sorry. The before. Thank you. And in summary, the result of our study suggests that the intelligent continuous body temperature monitoring system, ICT-BMS, can be applied to the ICU as a supplement to the convenient temperature measurement method, especially for the critically ill patients with infection diseases. Our study is also the first exploration of the application of thermistor products developed based on 5G technology and the AI technology in ICU. In the future, our team will further explore the application of AI technology in first aid and intensive care. And this is the reference. And that's all. Thank you.
Thank you very much, Jiaying Tang, for a remarkable presentation. At this point, we are moving forward to our second presenter. Our second speaker has more than 30 years of nursing experience in clinical nursing, management, nursing education, and nursing information construction. Making nurse work easier and patients safer remains to be her professional commitment. Our speaker has a remarkable journey in nursing and healthcare, and that includes the nursing director of the University of Hong Kong Shenzhen Hospital from 2010 to 2020, associate nursing director of Peking University Shenzhen Hospital from 2001 to 2010, advanced nursing training course officer of the National University Hospital Singapore from 1997 to 1999, Hospital Management Visiting Fellow at the Methodist Hospital USA up to May 2007, and at the Chinese University of Hong Kong Professional Diploma Program in Advanced Nursing Practice. She received the following honors and social activities: 2020 Asian Hospital Management Award for Patient Safety, 2019 Asian Hospital Management Award for Nursing Excellence, 2019 Nursing Management and Innovation in Guangdong Province. She is the student supervisor of Jinan University at Yangtze University and Guangxi University of Chinese Medicine, an editorial board member of Chinese Nursing Management, Chinese Nursing Research, Journal of Nursing Science, board member of Chinese Medical Information and Big Data Association, among others. She also presented a lot of scholarly work at the ICN Congress in Singapore, in Barcelona, and in previous years. My dear colleagues in the nursing profession, join me in welcoming Shi Lanping, RN MPH, Professor and Vice President, CNO, Hospital Commissioning Team of Shenzhen Shanghai Taiking International Hospital, for her research entitled The Establishment and Evaluation of Nursing Clinical Decision Support System.
Hi, good morning, everyone. Thanks, Professor Joseph, for the detailed introduction. I'm Shi Lanping from Shenzhen Qianhai Taikan International Hospital, China. It is my great honor to share with all of you my topic is the establishment and evaluation of nursing clinical decision support system. The outline of my part as follows. First part is background. As we know, the nursing team is an essential component in the patient care delivery. However, at the clinical side, most of young nurses with limited work experience often feel difficulty in facing complicated clinical situations. They need timely support. Lack of adequate professional support and instruction could affect the quality of the nursing care and the patient safety. Timely advice and guidance output is extremely important for both nurses and the patient safety. Clinical Decision Support System is a computer-based program that analyzes data in electronic health recording to provide guidance to assist healthcare providers in implementing evidence-based clinical practice at the point of the care. It has shown the significant quality and safety improvement in the patient care and workflow. The current CDSS system is limited to specialty or disease. Meanwhile, the system covered multidisciplinary activity is rarely reported. Our project objective, the main objective is to establish the and implement a CDSS system, provide clinical nurse effective decision support, ensure front nurse apply evidence-based practice, promote quality of the nursing care. Third part is method. Set up the project team. We have the totally 8 steps. First one is set up our project teams. The team leader is the nursing director of the central nursing department, who is responsible for managing and coordinating the project. There are 2 sub-teams. The nursing knowledge-based researcher team consists of the nursing expert, responsible for formulating a knowledge base of the nursing standard. The team member regularly collect clinical feedback and review and revise SOP according to the changes of the national and the international standards. The member of the clinical operating team are advanced planners and IT engineer. They collect the feedback for clinical nurses to assess the programs of the project in order to make the continuous improvement for better application. Literature review and conduct investigation to collect the nurses' need. We have interviewed many frontline nurses and also hold regular meetings, discuss every step and every procedures. Formulating evidence-based knowledge bases. We have built up the nursing standard operation procedure based on the best practice from evidence-based guideline, systematic reviews, and RCT. It was not only simple searching evidence, but also screening for high-quality evidences, evaluating their applicability and feasibility, and refining as specific standard operating procedure. It cost almost 2 years to finish the first version of the nursing SOP. Establish the CDSS system. We have also launched the system to correlate the assessment score with the recommended intervention, nursing plan, and healthcare education material. This system combined with the EHRS, which can trigger early warning and reminder to provide decision-making support. The training part, we have done many lectures and workshops. Make sure all nurses can operate in the system properly. Next. The clinical implementation. This slide shows our nursing access interface. You can see the nurse can easily get assessment SOP for decision make. This is the PIN assessment guideline. This shows our system could correlate the nursing diagnosis with the intervention guideline. Yes. Okay. This also can correlate the nursing care plan with the intervention guideline. It is easy for nurse to select the appropriate intervention measure. The system evaluation. We have done a staff survey and a clinical order, also monitored the quality indicator of the injury and medical errors. Results. By the end of 2018, evidence-based nursing knowledge base has been established, including items of the 25 nursing assessment, 405 nursing measure, 188 health education material, and 544 nursing plans in 34 nursing specialties. The compliance rate in general words of the CDSS was 100%. By comparing the nursing document audit data, the qualified rate of the nursing record increased 60% from the 2018 to 2019. Nursing quality indicators show that medication error decreased 38.5%, pressure injury rate decreased 45.5% from the 2018 to 2019. The nursing satisfaction rate was 89%. 88% nurses found that is well integrated with the nursing documentation and well used clinical practice. 90% stated that various knowledge could be obtained. 90% thought the interface was friendly and easy to use. 92% believe that it is effectively predict the potential patient risk. Conclusion. Our system provides effective decision support for clinical nurses, improved the quality of the care and achieved efficient patient-centered care, promote standardization of the nursing documentation, and provide ground basis for future research and smart nursing. To conclude this project, we have devoted a lot of the effort to establish the CDSS system. It turns out that nurses in this hospital could really benefit from this system. In 2019, we have achieved an Excellent Nursing Award in Asian Hospital Management. At the end of my presentation, I'd like to thank all the members of this project, and thanks for the support from the Hong Kong U Shenzhen Hospital Nursing team. Thank you very much. Thank you.
Our gratitude to Professor Shi Lanping for her outstanding presentation. Thank you. It's remarkable to know how clinical decision support system was established and improved nursing care and as a potential source of best practices. Moving forward, it is my pleasure to introduce our third and final presenter from St. Luke's International University in Japan. Our next speaker is currently working as a postdoctoral researcher in the Department of Global Health Nursing at St. Luke's International University, Japan. With the MEXT doctoral fellowship, he attained Doctor of Nursing Science degree from this university in 2021. He completed undergraduate and Master of Science in Population Science from the University of Rajshahi, Bangladesh as the top student. After graduation, he worked over 8 years in well-reputed international research and development organizations such as Swiss Agency for Development and Cooperation and International Rice Center Research Institute, and experience in empirical research in diversified fields. He also worked for different time periods in the World Health Organization and University of Tokyo as a part-time. Besides, he has 2.5 years teaching experience in the field of maternal and child health. That's very interesting. Public health and nutrition, global health nursing, and Cochrane systematic review as an adjunct guest lecturer, teaching assistant in different institutions including St. Luke's International University, Tokyo Medical and Dental University, Cochrane, Japan, Cochrane, Taiwan. He is highly skilled in evidence synthesis, especially Cochrane systematic review. As an expert, he facilitated several workshops on systematic review and meta-analysis, electronic database searching, and data analysis using RevMan, Stata, and SPSS. His research emphasis on the field of public health especially focused on mHealth, digital health, infectious disease epidemiology, non-communicable diseases, maternal and child health. His academic and professional experience in the field of public health has resulted in over 22 research publications in prestigious peer-reviewed journals, including Cochrane Database of Systematic Reviews. Many of his current research relates to the development and implementation of innovative approaches to public health, maternal and child health, and policy development. He has expanded his experience to scientific societies through peer review of international journals. His professional experience, research focus, and philosophy are strongly aligned with several sustainable development goal targets. Dear friends and colleagues, let us all welcome and say Ohayo gozaimasu to our speaker, MD Obaidur Rahman, for the presentation of his study entitled Effects of Mobile Phone-Based Healthcare Interventions on Improving Antenatal Care Visits and Skilled Delivery Care in Low and Middle Income Countries, a Systematic Review and Meta-Analysis.
Thank you, and good morning, and very nice to meet you all. And my name is MD Obaid Rahman. I am a postdoctoral researcher in the Department of Global Health Nursing, St. Luke International University, Japan. I am going to present my research, and my research topic is the effect of mobile phone-based healthcare interventions on improving antenatal care visits and skill delivery the skill delivery care in low and middle income countries. And this study is a systematic review and meta-analysis. Background. Globally, maternal and child mortality has been decreased in the last 2 decades, but it remains unacceptably high in low and middle income countries. And prior evidence found that antenatal care and skill delivery services have a great potential to decrease maternal and infant mortality, but the uptake of this service is not optimal in low and middle income countries. in recent times, using information and communication technology, mobile phone are being used to support the health service uptake effectively. Though mHealth intervention could potentially improve the service utilization, but the effectiveness of this intervention remain unclear. And most of the evidence comes from the pilot study and or small scale project or non-randomized studies. And also there has no comprehensive and concrete evaluation of effectiveness of mHealth intervention on healthcare utilization among the pregnant women. Therefore, this systematic review and meta-analysis aims to explore and synthesize the effect of mHealth intervention on improving the uptake of antenatal care visits, skilled birth attendants at the time of the delivery, and facility delivery services among healthy pregnant women in low and middle income countries. And this systematic review has already been registered in the Prospero databases, and we follow the Cochrane guideline and also PRISMA guideline to conduct this systematic review and meta-analysis. The study eligibility criteria has been defined in the PICOS framework, and we included studies if the study conducted on the low-risk reproductive aged pregnant women. And we did not include the high-risk pregnant women in this systematic review. And we considered all forms of mHealth intervention, including SMS, phone call, voice message, apps, mobile voucher, and other forms of mobile phone-based healthcare interventions. And we included studies if the study compared the effectiveness of mHealth intervention with the standard care. And we included studies if the study reported only the proportion of focused antenatal care visit outcome, skilled birth attendance outcome, and also facility delivery outcomes. And we included only randomized control trials that conducted in the low and middle income countries, and we followed the World Bank country classification at the time of the study implementation. To identify the relevant randomized control trials, we performed a comprehensive search on electronic databases and other resources on October 2020, and we searched PubMed, Embase, Cochrane Library, Sinahol, Web of Science, PsycInfo, British Nursing Index, and Medline and Popline databases. And we also performed the reference snowballing, including the searching the reference list of the included studies and also the relevant systematic review. And two independent reviewers performed the study selection, risk of bias assessment, and certainty of the evidence assessment of the included studies. And we use the Cochrane risk of bias assessment tools to assess the risk of bias of the included studies, and to assess the certainty of the evidence, we followed the GRADE approach. And to summarize the effect of mHealth intervention on improving the focused antenatal care visits or skilled birth attendance or facility delivery outcome, we performed a pair-wise random effect meta-analysis. And we also performed the subgroup analysis considering the way of communication and baseline service coverages, considering the cutoff of 80% of service coverage at the baseline. And to assess the publication bias or a small study effect in the meta-analysis, we used the funnel plots and agar test in this systematic review. We identified 9 randomized control trials and more than 10,000 pregnant women included in these studies, and studies conducted in the Brazil, China, Ethiopia, India, Kenya, Nigeria, and Tanzania. And the studies published between 2012 to 2018. And we see most of the studies published in the recent times. And we found different form of intervention mediums that are being compared with standard care, that is the SMS with mobile voucher, phone call and SMS interventions, and voice message and with animation film clips. And a different form of the intervention has been used for one-way communication or two-way communication, and the function of intervention are appointment reminder, health education or health advice, and preventive health information. This slide shows the study quality of the included studies, and we found most of the studies have the low risk of bias, and only one study we found that have the high risk of bias in the multiple domain of Cochrane risk of bias assessment tools. And we summarize the effect of mHealth intervention for the antenatal care visit outcomes, and we perform a subgroup analysis considering the one-way communication and two-way communication with standard care. Only 5 studies reported this outcome, and we found a significant effect of mobile phone-based healthcare interventions on improving the focused antenatal care visits, irrespective of way of communication, that is one-way communication and two-way communication. Both are effective for improving focused antenatal care visits. And the certainty of the evidence for the one-way mHealth communication interventions is the moderate, and the low certainty evidence for the two-way communication intervention. And the effect of the one-way communication intervention is higher than the two-way communication intervention. And due to high heterogeneity among the subgroup, we did not combine the effect of this intervention. And oh, and for skill birth attendance outcome, and 5 studies reported this outcome, and we did not find any significant differences for one-way communication intervention and the for improving the skill birth attendance, but the certainty of the evidence is very low. And we found a significant effect of increasing the skill birth attendance outcome for the two-way mHealth communication mHealth interventions compared with standard care, and the certainty of the evidence is the moderate. Only three study assess the facility delivery outcome, and we perform a subgroup analysis considering the baseline service coverages, and we see mHealth intervention can improve the facility delivery in the place where the baseline facility services is very low. But we did not find any significant differences between mHealth intervention with standard care for improving facility delivery, where the facility delivery service is very high, and we could not combine the effect of the subgroups because of higher heterogeneity. And in summary, we can say the mHealth intervention can contribute towards improving antenatal care visits and skill delivery care utilization among the pregnant women in low and middle income countries, particularly one-way mHealth interventions for improving the focused antenatal care utilization, and the two-way mHealth intervention that can increase for skill birth attendance at the time of the delivery. And the intervention may increase the facility delivery where the fewer pregnant women use the facility delivery services. As very few studies included in our meta-analysis, therefore the further studies are required to confirm the effectiveness of our estimates. And that's all, and thank you for your kind attention, and if you have any question or comments, you can ask me or email me. Yeah, thank you all.
Thank you very much, MD Ubaidur Rahman. At this point, we will now proceed to the question and answer segment as we again welcome our remarkable presenters in this concurrent oral abstract session on digital health and innovation. Jiaying Tang from Zhejiang University College of Medicine, Lan Ping Shi, the Vice President of NCNO Hospital Commissioning Team of Zensen Qinghai Taiking International Hospital, and MD Obaidur Rahman, a postdoctoral researcher at the Graduate School of Nursing Science, St. Luke's International University, Japan. My first question goes to Jiaying Tang. However, other speakers can also give their thoughts on this inquiry. So your discussion is very interesting. Uh, it actually talks about the application of 5G technology in body temperature monitoring. And as the healthcare field advances to the fourth industrial age, may I know what are your thoughts on the development status and application prospect of artificial intelligence technology in critical care and medicine?
Yes. As we all know, critically ill patients admitted to the ICU are closely routines in order to be able to quickly respond to any changes. This monitoring data can be used to train AI models to predict critical phases in advance, making an error and reaction as soon as possible. At present, much of the work in critical care using AI technology has focused on the predictive analysis, image, image creation, medication delivery, and so on. And AI models have been developed that can help trigger trauma patients and thereby appropriate and timely resources utilization. Similarly, identification of patients with the same critical needs has has been provided a framework for further organizational innovations in the ICU and provide better cost-effective care. At the same time, the use of AI technology is more likely to create a new job field that focus on advancement of critical care. It's my opinion. Thank you.
Okay, thank you very much for that very wonderful response. As a nurse informaticist myself, I do agree that artificial intelligence will change the way we practice nursing in the future and will provide a lot of possibilities. Thank you. Um, Professor Shalan Ping provided us with an interesting presentation in establishing and evaluating a nursing clinical decision support system. And I am curious about the challenges that you encountered in the process. So I want to ask, what kind of difficulties did you encounter during the implementation of this project? I do understand that sometimes it's difficult to introduce a new technology in the clinical practice, and I would like to know your challenges and how did you um, how did you address those challenges, Professor?
Okay. Okay, thank you for your question. Nursing CDS system is a huge project which need a continuous improvement. At the beginning of the project, we facing two kind of the challenges. Uh, First one, we have built up nursing standard operation procedures based on this from evidence-based guidelines, systematic review, and RCT. Uh, it was not only the simply researching evidence, but also screening for high-quality evidence, evaluating the applicability and feasibilities, and refining as a specific standard operating procedure. It cost almost 2 years to finish the first version of the nursing SOP. Second one, we have also launched the system to correlate the assessment score with the recommended intervention, plans, and healthcare education material. This system is combined with the EHR, electronic health recording system, which can trigger early warning and a reminder to provide decision making. So the project is not a one-step process, but an ongoing process since 2015. We regularly review and revise the SOPs, and the system's rules continue to pursue the quality improved. Thank you. Thank you.
Yeah. Thank you very much, Professor. Um, MD Obaidur Rahman provided us with a very good systematic review study on the use of mobile phone on antenatal care visit. As a researcher myself, I do acknowledge that meta-analysis provide the highest form of evidence for evidence-based practice. With this, I have several questions. So first, in your systematic review, you considered only healthy pregnant women. Why did you include only healthy pregnant women and didn't include high risk pregnant women in your review?
Okay. Yeah, thank you for your question. And actually, I consider the high risk, low risk or healthy pregnant women in my systematic review because we see these pregnant women does not have enough access to service coverages in most low and middle income countries. And high risk pregnant women, we see they have the higher medical adherence. If I consider the pregnant women with the HIV/AIDS or cardiovascular disease, they already have the good connection with the healthcare providers and go to the health center and taking the service and skill services during the pregnancy or prenatal time periods. And another reason for excluding the high risk pregnant women from my study, because if I considered only similar types of population, yeah, and perform the meta analysis, and it will give the more precise estimates, and our result shows the more precise estimates, and yeah, that's why I included only the healthy pregnant women in my study.
Okay, that's
Yeah,
really
thank you.
a very impressive response. And I really love this study because this is a meta-analysis, and I know this can be converted into something that we can utilize in the nursing practice, including policy. Um, uh, I want you to highlight the outcomes of the study. Can you explain how mHealth intervention can improve healthcare service utilization among pregnant women?
Yeah, thank you. And actually, using mobile phone or mHealth intervention, we can provide the basic health information or knowledge or tailored information, healthcare reminder, and also the patient and the healthcare provider. They can real-time communication with the skilled healthcare, and they can these information and knowledge that can make sense the individual level practices, and it can through increasing their knowledge and behavior, and that can and when they also motivated using this information, and they can also get support, psychological and social support from the healthcare professionals during the perinatal period, and they make their positive changes in their behavior and go to the health facilities, and that can make promote to not delay in the going to the health centers, and as a result they go to the health centers and get the services. And also complication can be managed between the visits through two-way communication, where the pregnant woman, if does not get oil and make any complications during the visits, they can directly communicate with the health service providers and get the skill services. Yeah, thank you.
Okay, thank you. Thank you very much for that very wonderful answer. And we have a very good number and quality of research at this digital and innovation section this year. So as we come to a close, we wish to thank our presenters for their outstanding work and presentation. Again, thank you, Jai Tang, for your study, application of intelligent continuous body temperature detection system based on 5G technology in body temperature monitoring of ICU. Professor Shi Lan Ping, for your work on the establishment and evaluation of nursing clinical decision support system. And finally, MD Obaidur Rahman, for your output on the effects of mobile phone-based healthcare interventions on improving antenatal care visits and scale delivery care in low and middle income countries, a systematic review and meta-analysis. My dear friends, there's no doubt mental health innovation is changing the landscape of the nursing practice. However, we should always acknowledge that we need to place nursing and caring at the center and core of our practice. As Dan Brown mentioned on his novel entitled The Origin, may our philosophies keep pace with our technologies, may our compassion keep pace with our powers, and may love, not fear, be the engine of change. With that, thank you very much again to our speakers and to our attendees. We are very grateful for joining with us. Thank you very much Keep safe and well.